Welcome to Buffalo Rumblings Live. My name is Matt Warren. I'm joined today by Dr. Ali, I'm going to screw it up, Dr. Ali Mohamadi.
That's right.
Did I get it right?
Yeah, you got it.
Yes, okay. And he's SB Nation's uh, injury expert. Let me just read real quick on Dr. Mohamadi's bio. He went to Yale before going to George Washington University School of Medicine. He did his residency and chief residency at Mount Sinai School of Medicine in New York City. And he's really smart. He his subspecialty is in endocrinology. Speciality is in endocrinology. He did that at Johns Hopkins, and he's really smart. If you want to see his whole bio, it's on our website. So the first question I have is, how did you get so smart?
Well, first of all, let me say hello, Bills Nation, and you guys can be the judges of whether or not I have any intelligence at all after this. I guess good parents, I don't know, good genes, but I would not go so far as to call myself smart, that's for sure. You'll see.
Oh, okay. Okay, well, so his bio is really long. You can read it on our website. People asked on our in our comments section how we were able to get someone with so many degrees because they thought that people like you were only made up and on TV. So I just wanted to make sure that I got that in there. Moving into some stuff that's a little bit more serious. Kiko Alonso tore his ACL earlier this week doing some training up in Oregon. And that's why we have you on. We have a legitimate doctor and all this stuff to talk to us about ACL injuries. Can you just briefly go over what an ACL tear entails? And I don't want you to speculate on how the injury occurred because we have no way of knowing that, but just how these type of injuries affect players on the field without an ACL.
Yeah, sure, no problem. So just kind of to go through the anatomy, the ACL is a ligament, which is a tough band of tissue that connects the femur, which is the thigh bone, with the tibia, which is the shin bone. And it's actually really crucially important for stabilization of the knee and for making sure that there's coordination at the joint and that basically it doesn't slip out of place. You're right, we can't speculate on what exactly happened here, but the most common way that an ACL injury takes place, or an ACL tear in this case, is what's known as a non-contact injury. So actually no, not being hit, not running into anything, it's just a false step. What the ACL actually does is it keeps the lower leg, the shin, turning bar. And when you suffer an injury to the ACL, one of the primary things that happens forward and out of place, or it can slide inward because you're missing that traction. There have been a lot of high-profile ACL injuries, before Alonso's. Obviously, on the one end of the spectrum in terms of recovery, which we'll get into in a second, there's Adrian Peterson. On the other end of the spectrum of recovery, which isn't in football, but I think is a pretty good analogy, is Derrick Rose. The recovery period really differs from individual to individual, but now what they're saying is that the most common time frame for recovery is somewhere between 7 to 9 months.
And so you think that when we hear Adam Schefter saying that it's a 7 to 9 month recovery, that it's a tear and not a sprain, because there's been a few conflicting reports out there that it was a severe sprain or even a strain as opposed to a complete tear.
Yeah, I mean, so first of all, if you just go by the time frame, that's what you have to assume. Just to be clear, there is. So like there's 3 degrees of sprains. First degree sprain is a mild amount of tearing, and the important thing is that it doesn't cause that much instability in the knee. A grade 2 tear is a fairly serious tear, but there may be some knee tears from the urine.
Okay. I can't hear you anymore, and you've been lagging for me. So, oh, there's the picture came back. Okay, that's cool.
Sorry.
I'm assuming that what you said was really awesome. I just can't
I'm sorry,
ask you anything
guys.
about it. It's okay. I don't know if it's me or you. So can you explain a little bit what the rehab entails and how they're going to
Yeah.
be treating this from
Yes.
surgery to the physical therapy?
Yeah. So first off, can you hear me now?
I can hear you now. Yeah.
Okay, great. Yeah, sorry about that, everybody. All right. So we were saying it's about a 7 to 9 month process. Really, the rehab starts even before surgery, and the first and foremost thing is making sure that the swelling and the pain and the inflammation in the knee subsides. There's a push now for surgeons to do the surgery as soon as possible. Adrian Peterson had his done 6 days following the injury, but for example, someone like Navarro Bowman, it took a full 2 weeks before they did the surgery. So that's the first step. The second step is the actual surgery, and then rehab starts literally the day of surgery. The first thing you want to do is make sure that the patient can extend the knee, which means to bring the knee all the way straight. And that's actually the most crucial part of treating an ACL, because the biggest fear is that you'll lose full extension if you don't heal properly. Then over the course of the next 6 months, you start off on crutches for a couple of weeks, then you get full weight bearing. You start walking at about 2 weeks, you start jogging at 2 months, you start cutting at 4 months. By the time you have enough strength in your muscles and your knee to start sprinting, you're talking about 6 months. And then from there on out, whether somebody comes back like Adrian Peterson full bore at about 8 months, or whether it takes over a year like Derrick Rose, it has two main things. Number one is the strength of the muscles surrounding the ACL, and that's all about rehab. How aggressive the physical. The second is something that you don't hear a lot about, called proprioception. So what proprioception basically is your ability to sense movements of joints and all of the structures around it. So the way I like to think about it is, if you think about your elbow and you close your eyes, and somebody moves your elbow in or out, you have a sense of which way your elbow is moving. With the knee, it's the same thing. And people who have a lot of trouble getting back from an ACL tear, often that sense, that proprioception, will be described as being off. Derrick Rose, for example, felt like he had no sense whatsoever of the movements of his knee, even though structurally it was sound. Adrian Peterson obviously was the complete opposite. Here in D.C., Robert Griffin III was somewhere in the middle. He came back after 9 months, but if you watched him play, and I watched him play the whole season, he was not the same. And it's clear to me that a lot of that had to do with his just sense, his general sense that everything wasn't quite right there.
Yeah, we forgot to mention off the top that Dr. Mohamadi is a Redskins fan, and we will not hold that against him.
Yeah, sorry, guys, but to be totally honest with you, I mean, it's kind of rough being a Redskins.
It's not as rough being a Redskins fan as it is being a Bills fan, even though I think the last time we played, we beat you. Oh, yeah, that was a Toronto game. Yeah, ooh, go Toronto. That was like our one victory in Toronto. So, I mean, you guys win that one.
Yeah.
All right, so
yeah.
What are the long-term implications of this type of injury? There was a time when it was, I mean, almost a career-ending injury, but that's not the case now, as you've explained with certainly Adrian Peterson. What are his is he going to be able to come back, say, a year from now, and be able to fully participate and be the same Kiko Alonso we knew?
So, you're absolutely right. Even 10, maybe 15 years ago, the prognosis for a quick, rapid, and successful comeback was a lot worse than it is now. And this almost entirely and exclusively has to do with the fact that rehab has gotten extremely aggressive. What I was trying to say before I cut out, and I'm really sorry about that earlier, rehab starts the day of surgery. I mean, people start working on that knee and working on strengthening the muscles literally from the day of surgery. They've gotten much more aggressive. The prognosis that at this time next year, and certainly for training camp next year, that Kiko Alonso will be in the fold is excellent. But like I said before, each individual is a little bit different. So while it's not 100% that at this time next year he'll be on the field, you got to feel really, really good that he'll be, not only will he be back, but that he'll be playing at a very high level again.
Okay, well that's good. Dan Lavoie, one of our readers, asked, is there any merit to the idea that ACL tears are more common when a person starts ramping up their workout regimen after inactivity, which is one of the things a lot of people talked about last year with the new CBA.
Yes, so I'm gonna admit that I did look at the site before and saw the comments, some of which
Nice.
I particularly liked. Yeah, I like the question about my favorite boxer. That's one that I've never gotten before. But I love that question. So this is actually something that has gotten a lot of input and a lot of people have been looking at because in 2000 injury. And so obviously the NFL has done a lot of research, and obviously a lot of media members have done a lot of research of why this is. And there are people, including, I'm sorry to mention this name on your air, Bill Belichick, who believe that there is I know, I said I'm going to go there, but yes, I know what you're saying, Buffalo. There are a lot of people, Belichick included, who feel like there's a direct link between the fact that with the new collective bargaining agreement, players are not allowed to participate nearly as much in the off-season in organized activities as they used to. And his thought process is that it has to do directly with a lack of conditioning in the off-season. The pat answer is that there are so many factors that could go into this that it's very difficult to say. That is one theory, that it's a lack of conditioning. Another theory is that it's not so much that they're not conditioning themselves well, but they are lacking the insight of the training staff that they have at the field and in the facilities, and so maybe they're doing specific exercises that are particularly dangerous. There's another thought that and we have a grass field here in DC, but that more and more individuals are using turf fields, field turf, and that not only the turf but perhaps the shoes themselves may be rougher on the knees. Some people feel that it's just chance. There were 27 ACL tears before the season last year, but if you look back, over the course of the last 10 years, it's waxed and waned from as low as 12 to 25 just a few years also, so it's gone up and down. The short answer is there's no clear correlation, but there are definitely people who feel that it has to do with the way that training has changed due to the CBA. Okay,
and I'm going to get you out of here with one last question. Kiko Alonso had surgery to repair something in his hip. I can't remember what it was, so I'm not going to.
His labrum.
That's what I thought. Okay, so do you think, does that contribute at all? Could that contribute at all to putting added strain on the knee if he's rehabbing that?
Yeah, so I saw that question too, and that was another excellent question. So the bottom line is that whenever you're recovering from any injury to any part of the body, it puts added strain on that general area of your body. And beyond that, a lot of the times you'll find that athletes will somewhat overcompensate, because they're guarding against re-injuring, or because they're feeling pain, or because they're just, maybe more than anything else, they're just generally weaker there, that their other structures have to overcompensate. Obviously, any of us know exactly what happened or how this happened, but there is room to speculate that the fact that there was an injury to the leg, even though it's a different area of the leg, may have caused some extra stress. Again, hard to say. It very well could be unrelated, but it is something to consider.
And what a couple people don't even realize is that he actually tore his other ACL in college and lost the season at Oregon because of it.
And this is actually a really, really good point, because the risk of injuring the opposite knee, tearing the ACL of the opposite knee if you've already torn one ACL, is significantly higher. So, he's kind of following a pattern here. But, to be clear, Bills Nation, my prediction is he'll come back and he'll be out.
Okay. Well, thank you very much, Dr. Mohamadi. If you want to hop off the phone call, I really thank you for your time. And we're going to get going into who's going to replace Kiko Alonso and how the Bills might move forward. So thank you very much for your time.
All right. Thanks. Happy 4th of July, everyone.
Same to you. All right. So now let's talk about how the Bills are going to replace Kiko Alonso. Brian Galliford at our site, BuffaloRumblings.com, wrote a piece just yesterday and talked about some of it. There have been a couple different things put around, but Kiko was moved from the middle linebacker spot to the weak side linebacker under Jim Schwartz as they transitioned back to a 4-3 scheme. And the whole point of that was that he was going to be the 3-down linebacker, the guy that covered people on third down in passing situations, the guy that was going to make the tackle on first and second down. He was going to be the linchpin, really, of their defense. And so they don't have anyone else on their roster that can do what Kiko Alonso did. That's why he was moved to that position. So it's really going to be a 2 or maybe even a 3-pronged approach to it. So let's talk about a few different guys that are going to factor into this. One person that's probably going to really factor into it is Nigel Bradham, the linebacker who the Bills have had for several years. And he played 284 snaps a year ago, only 25% of the snaps. But with Kiko Alonso playing 100% of the snaps, Bradham being his primary backup didn't see a ton of those snaps. He's going to be coming in, and he'll be doing some of the first and second down stuff. I don't know if he has necessarily the range in coverage for third down. Actually, Brian Galliford made a very interesting prediction, I guess you would say, for what they might do. And they might bring in Denoris Searcy a lot more as kind of that Brian Scott safety in the nickel package, playing nickel linebacker and covering tight ends and doing things like that. So that's a very interesting kind of package deal where you'll see Searcy come down into the box and then roll with maybe Duke Williams over the top at safety during some of those nickel looks. Keith Rivers has talked about moving over to the will side. Right now he's on the strong side, or at least that's where he was taking a lot of his snaps during the spring. But when Kiko Alonso was out in the spring, because again he was rehabbing from that labrum tear, that Rivers was actually the one that went over and took his spot most of the time. So it's very interesting that he could move over there, and then say a rookie like Preston Brown could come in and play the strong side. One last option is having Preston Brown over on the will side, just kind of slotting him in. For his first couple seasons at Louisville, that's what he played. He played outside linebacker before getting shifted into middle linebacker during his junior season at Louisville. So it could be very interesting. Lots of different ways that Jim Schwartz could attack this. But as I keep saying, it's not going to be one person that steps into Kiko Alonso's spot. If it was the matter of one person, it wouldn't probably be a big issue. But then again, the Bills wouldn't have the depth problems that maybe problems is the wrong word. If they had 2 Kiko Alonsos, I think we'd be okay. And I think everybody pretty much agrees with that, but they don't. Most of the questions that were posted in our comment section on Buffalo Rumblings Live were for Dr. Mohamadi, which is super awesome, and I'm glad we were able to get that expert on here. If you have any questions about how the Bills might replace Kiko Alonso, throw them in the comment section now as we wrap up. Another guy who's probably going to see increased playing time is Brandon Spikes, and I know that he was going to be a 2-down linebacker, but in some cases he may have been subbed out or things like that, and now he's not going to be quite as much. He's going to be really looked to as the leader of that linebacker core now, even more so than he was before. Before he was the veteran leader. Now he's got to be a playmaker. He's got to step into that Kiko Alonso playmaker role. I've got a quote here from Doug Whaley on Rivers when he signed with the Bills from the New York Giants. He's a 4-down linebacker. He can play the first and second downs, the typical run downs. He can stay on and third down and cover, which is very much what he might do, say, spelling Nigel Bradham going back and forth on the weak side possibly. He can stay in on third down and cover, this is Whaley again, because he's got athletic ability, and then he can contribute on special teams. If I were the Bills right now, I wouldn't have Keith Rivers in on special teams. His injury history, let me just look it up real quick. Want him playing special teams when you're already down a linebacker. That's been the biggest problem with Rivers' career so far, is that he gets going, and then all of a sudden stops because he gets injured. Let's see, got it up here. So his rookie season, he only played 7 games. That was, I believe the year he took a vicious shot from Hines Ward that knocked him out for the rest of the season. He played in 13 games. The next year, 15 in his third season before 0 games for Cincinnati in 2011. With the Giants, he played in 11 games in his first year, and then last year was really his first full season in the NFL, playing all 16 games, starting 9 for the New York Giants before being signed by the Bills here in free agency. So if I'm putting all my eggs in the Keith Rivers basket, I think that might be a mistake. Despite his athletic talents, he wasn't drafted in the top 10 for nothing. So he's going to see some probably significantly more playing time because of this injury. Here's a question from Dan Lavoie. Oh, no, it's a statement. I'm not sure how well Preston Brown can hold up in coverage, but I really liked his run defending and instincts while watching him in college. Dan, of course, is one of our draft guys. And Matthew Fairburn, formerly of SB Nation, but now with the Syracuse Media Group covering the Bills, said almost the same thing, that Preston Brown has the skill set to translate to outside linebacker in the Bills system. This is Dan Lavoie again. If he shows a decent amount of range, he can do the job. And DeBills questioned Dan, saying, could Spikes do it if they pushed him out there and had Brown in the middle? Brandon Spikes is not a guy that's going to take up a lot of space in that way. He's not going to cover a lot of ground. He certainly can't cover folks. That's why he is a 2-down linebacker. That's why he signed a 1-year deal. He doesn't have the pass coverage skills that one wants out of a 3-down linebacker. And Spikes was brought in to help the run defense on the middle. If they're going to move either of the two of those guys outside, it's probably going to be Brown, even though you kind of want to get that rookie in one spot and learning one spot. I think the better option athletically is Preston Brown moving to the outside, because he's got the ability to go I don't know necessarily sideline to sideline, but he's certainly got more range than Brandon Spikes does. And Brian Galliford also wrote about Brown in his piece about replacing Kiko, saying that that Brown is, of course, the name to watch, and that's absolutely true. Let's see here. Just going to quick check Twitter to see if we've got any other questions, comments, things like that, and then we'll call it a day. Because even though I've got plenty of folks watching, they're not asking any questions today. Okay. All right. So with that in mind, the Bills, lots of different guys are going to be stepping into Kiko Alonso's spot. We are 1 month away today from the Hall of Fame game, where we'll see probably several guys, including Preston Brown, taking over that weak side linebacker spot. Thanks, everyone, for tuning in. My name is Matt Warren, and this has been Buffalo Rumblings Live. Go Bills.